Hi, we're Brian and Jody Spitzer from Green Bay, Wisconsin. I have a Medicare background.
I have a dental hygiene background. We have 5 kids, 3 daughters, 2 sons, and we have 2 beautiful granddaughters. So I first heard about Impact just a couple years ago. Impact Health Sharing is it's a super alternative to the rising cost of health insurance. And I didn't really understand how it worked in comparison to health insurance. Before Impact Health Sharing, we just had traditional insurance and we had high deductibles, and they took a lot of money out of his check every other week. And it just felt like we just always had big medical bills. But since we've had Impact Health Sharing, we pay a low monthly rate, and the deductible is much lower. It's a primary responsibility amount, and it's only $2,500 for a family. Once that deductible is met, or that responsibility amount is met, Impact pays 90%, so we're only responsible for 10%. The best part about it is every single bill that we do get is negotiated down, so the bills we do get are the lowest price possible. Our daughter just broke her ankle, and had we have had our traditional health insurance, the bill would have been like $2,200 with seeing this doctor. And because Impact negotiated the rate down, it was only $800, so we saved $1,400.
I was excited about being offered, we've always been offered just regular health care through my employer, and we were excited about the cost savings with Impact. We knew it'd be a little more affordable that way, and I love the open network. You can go see any doctor, go to any facility. So we like that. It opens it up on where you can go.
What's super great about it is it's a family responsibility amount. So you get, with 5 kids and ourselves, we get to that deductible a lot faster, obviously, than if it was just us. And usually insurance has individual deductibles and then family maxes. Impact also has a $5,000 out-of-pocket max. So once you meet your PRA and Impact starts paying and sharing in your medical bills, $5,000 out-of-pocket max is super. So other health sharings that we learned about or looked at, you have to pay your bills all up front and then you have to wait for reimbursement, and that's not how Impact worked. When we go to the doctor, we just pay the copay, and then we give the doctor the card, and they bill Impact just as they would traditional health insurance.
I think one of the other parts we really liked is with most health sharing companies, you have to pay up front and then wait for reimbursement, which we've heard in the past people waiting literally 6 months to a year to reimburse or get some of that money back. I love that about Impact. You just show the card and it's filed electronically, so it's timely payment to the provider, which really truly is better for you as a member. It's better for them taking care of you. So I think it just works much smoother than regular health sharing.
I love that Impact Health Sharing is a love thy neighbor approach, where we're just literally sharing in each other's medical bills, and it's just a really feel-good company. You can be any religion, any race, any color, any creed, and it really just accepts everybody. One of the reasons that Impact Health Sharing saves people so much money is because it's truly designed for healthy to fairly healthy people, because it doesn't pay for pre-existing conditions that happened in the past 3 years, and you have to keep your body mass index under a certain amount as well, otherwise you have to pay more.
Which to me, I think is truly one of the best parts about it, because traditional healthcare, why are you paying higher premiums? You're paying higher premiums to offset the cost of people that do go in often or maybe do live a little non-healthier lifestyle. So truly, if you are a healthier person, you're paying for that. And I think it's very refreshing for new people looking at health sharing and understanding it for the first time, coming from a regular health insurance, we've had people paying well over $1,000 a month for a family, and in most cases, you literally can cut that in half for families that don't go in that often. And the truth is, I think that's most families.
So 5% of the population makes up more than 50% of all medical spend. So, what does that say? It's saying that people are just simply paying too much for a service that they rarely use. Most people don't even meet their deductible.
I think it's very common for working families to, in a lot of cases, not even really look at what they're paying monthly for health care, and in most cases, they're overpaying. So I think even for us, prior to seeing and understanding health sharing, to be honest, I've always been covered by an employer. So I knew what we were paying. However, the deductibles were high. We paid a lot out of pocket monthly to have it. We're super excited to have the opportunity to look at and understand health sharing. And I think a lot more people should look at it because it's a really nice, more cost-effective alternative, which still covers very well when you're going in or using it.
I believe health sharing is going to continue to grow and grow because it really gives you the freedom. You can go to any doctor, any hospital you would like. With insurance companies, they're really limiting people, and they want you to make sure that you're in network. This day and age, a lot of people are switching careers, which means they have to switch health insurance companies because that employer offers them something different. And with the HMOs and how you have to stay in network, people have to switch their doctors, and people don't like switching their doctors. Once they're comfortable with something, what's super about health sharing is you can go to any doctor, any provider you want.
Yeah, one of the best parts of Impact that we found we're kind of excited about is there's no enrollment period. Where typically with an employer you have to stay on it, and it's normally around November each year where you can make a change. Where Impact, there's truly no enrollment period. So if you're watching this video today, you can sign up now. There's no enrollment period. You don't have to wait to the end of the year or stay on a coverage maybe you're not happy with through the end of the year. You can do it now.
Healthcare is a problem in America, and it comes up in conversation all the time. Just ask people, what are you doing for healthcare? It just comes up, and you can help a lot of people save a lot of money. And when you can help people put that kind of money back in their pocket, that just really feels great.